Mental health and well-being effects of the COVID-19 pandemic cannot just be overemphasized. From the unprecedented social distancing measures or even physical distancing measures to the lockdown and the fear of contacting the ailment or contracting the ailment. Now, research shows mental health indicators such as anxiety, depression, loneliness, self-harm as some of the side effects. Well, joining us now to speak more on this and what can be done to reduce this is psychiatrist Dr. Banji Adesoji. Good morning and thanks so much for joining us.
Good morning. It's a pleasure to be here.
Yes. Now, according to the World Economic Forum, about 2.6 billion people are in some kind of lockdown globally. As a matter of fact, they say it is the world's biggest psychological experiment. And they went further by saying, look, a secondary epidemic of burnouts and stress-related absenteeism will begin to surface, around the end of the year. Now, speak to, some of the fallouts, especially psychologically and mentally, of COVID-19 that we're seeing now.
Thank you very much. The thing is, this is actually a combination of three pandemics. There is the pandemic of the virus itself, then there's the pandemic of fear, then there's the pandemic of hunger, or shall we say financial crisis. So here's the thing. Research has shown that crises or pandemics that have four main ingredients tend to be the most likely to induce a lot of stress. One is you have a novel virus. Two is it's a very deadly killer. Three is it's an invisible virus. And four is the fact that it is so contagious that they are asymptomatic carriers and anybody could carry the virus. So what are these going to cause? So the pandemic of fear is that it induces anxiety, induces depression, induces a lot of worry and the feeling that I'm about to die. Then you have the pandemic of fear of the virus itself, which is I could get it, or if you're a frontline healthcare worker, the next patient has it, or you're about to get the virus itself. And then the fear of the financial issues that are going to come as a result of this. All of this is a pressure cooker, a pressure cooker filled with stress, a lot of pain, and a lot of fear down the road that how am I going to deal with a lot of these issues. So I've had clients of mine who've walked out of the house, wandered away because as far as they were concerned, there was just no hope. Then you've had people who never used to have panic attacks suddenly develop panic attacks because they are flooded every day with news of, oh, there's so number of cases, so number of people have died. And in fact, I've had to tell some people to just switch off their phones, switch off their TV, and be careful with the kind of things you consume. So for me, there's the immediate effect of this whole pandemic. But then there's the short term and the long term. The short term is about 6 months' time when the tendency is for mental health effects to lag the crisis itself. So for instance, in 2008, when the financial crisis in the US, while people were afraid of losses and all that, mental health issues tended to show up 6 months after down the line. So you had a lot of depression cases, a lot of problematic substance use, a lot of emotional disharmony. And then you even started hearing that in places like China, after the lockdown, people have increased their numbers of divorces because people are dealing with the after effects of this post-traumatic stress.
Well, I had a question.
Yes, go ahead, please. I mean, it's so, just thinking about it, when it's talked about panic attack, that I hear a number of people beginning to say that.
Panic attacks, yes.
People are even afraid to drive all on their own these days.
Right.
I mean, so it's a clear and present danger.
Absolutely. Dr. Banji, I know that you mentioned anxiety being a common side effect of not only having to stay at home and be isolated, but also the fear of what the unknown that's happening outside with the pandemic itself. But if you were to identify a textbook case of anxiety, how would you say a said person would be able to handle that or treat it while they are, of course, under lockdown?
Well, the first thing about anxiety is that the prominent symptom is worrying, excessive worrying. And truth be told, in the days of COVID-19, we all have reasons to be worried. That's the truth. I'm a healthcare worker. Every time I come back home from going to the hospital, my family is worried that I have not brought the virus home. So it is very prominent and it's all over the place. But worrying and anxiety differ because the line of difference is the worrying and anxiety is pervasive, it's excessive, it distresses you that you're not able to move on with anything you would like to do. So the person who called me last week with a panic attack just said he had palpitations, he felt his heart beating very fast, his mouth was very dry, he felt very restless, and he's not been sleeping. So what I told him, because of course it was under a lockdown, was first you have to divorce yourself from whatever your triggers are. So for instance, if your trigger is, for instance, if you open YouTube, the first thing that comes up is WHO, COVID-19, learn more. So if that is your trigger, you need to reduce the kind of things you are ingesting that trigger your illness or trigger the attacks. The second is something that anybody could do at home, which is called a deep breathing exercise. And it's something that I can teach you now, and basically is that you take a deep breath for 4 seconds through your nose, but you breathe into your stomach, not your chest. So how you do it is you place both hands, one hand on your chest and one hand on your stomach.
Okay.
And if you feel your stomach rising, you're doing it well. But if your chest is only rising, then you're not doing it very well. And so you have deep breathing. So you breathe in for 4 seconds, you hold your breath for 7, and then you breathe out through your nose for 8 seconds. You do about 10 cycles of this, and what you would notice is the fear, the pressure, and then the feeling of your heart beating comes down. So those are some of the things you could do. Then the other things are exercise, yoga, meditation, mindfulness exercises have been found to be very good with anxiety disorders. And then of course always remind yourself that I'll survive this. There's life after COVID-19, and this too shall pass.
Staying
so,
positive.
Dr. Banji, we speak a lot in hypotheticals. You know, what if you were to catch it, or what do you do to assist people who have caught it around you? But what if you were the person who actually contracted COVID-19? The psychological effects of being told that you have something that everybody else says is not a death sentence, but you yourself have witnessed people dying from, it's quite stress-inducing. So how, therefore, would you ask a person who has just received news that they've contracted COVID-19 to keep their mental health stable? What should they be doing?
Or just an ordinary person who is not into healthcare. Because for healthline workers, the difference is you know what COVID-19 is. You know what the effects are. So there's a tendency for your brain to begin to dream up symptoms that are not there. So for a frontline health worker, what I'll tell themselves is a popular Yoruba saying, but which is very true, and it is farabale. You are not about to die. COVID-19 looks like a death sentence, but it is not. So the first thing you need to do is breathe. Just breathe. Focus on your breath and forget about whether it's going to kill you, whether you have pre-existing conditions, whether your hypertension or your family history of diabetes is going to come in. So that's for the frontline health worker. For the person who is not, basically it's to remember that, look, 2% mortality rate means 98 out of 100 with COVID-19 will survive it, will beat it. So it means the odds are in your favor. So basically, don't think you're about to die. And then there's something everybody who survived COVID-19 has said has helped, and it is that your mental state when you're going through it is more important than even the drugs or whatever they're going to give you. Because if you believe that you're going to get out of this, you will. That's the truth, because your mind will find a way to get you out of the situation. But if you feel this is the end of me, then your mind will, and the earth and the universe will find a way to make sure it is the end. So after that, the other things I would recommend: eat well, sleep well. The fever of COVID-19 can be very distressing, but it is important that you take paracetamol, not ibuprofen, because it's been found that ibuprofen can exacerbate symptoms. And then as much as possible, if you now even have to go into an isolation center or you have to be put on oxygen, remember, Boris Johnson is a 50-plus-year-old man with a lot of other pre-existing conditions, and he came out of it, and you will too.
Yeah, absolutely. And Chris Cuomo, for example, his doctor actually told him, stay positive, stay strong mentally, and you will overcome. And you can see that, that Cuomo fighting spirit is kicking in, and that cannot really be
and like what Dr. Banji said,
Yes.
psychologically speaking, it's like the placebo effect, isn't it? When
Exactly.
you believe something works and your mental state is there in the positive, like you said, then you have a better chance of actually beating, whatever virus or disease.
Absolutely. Now, Dr. Banji, it's been said that it takes 3 weeks for habits to form, and once those habits have been formed, it's difficult to break out of it. Now that we're all on lockdown, and you're at home with your spouse, who ordinarily you would not, spend time with your children and all of that. How do we protect ourselves in a way that, post COVID-19, social distancing, physical distancing, not seeing your family members and all of that will not become the new normal?
Okay, first of all, like a foreign minister in Singapore said in a YouTube video, COVID-19 is going to be with us for a long time. So even post-lockdown, there's still going to have to be social distancing in some regards. The way I see it is, in this Far East and Southeast Asia, wearing masks outside the house is normal. Social distancing is normal. Greeting people by either a bow or a namaste greeting is normal. And it might be our new normal. It's important that we remember, like a friend of mine said, there's BC and AC, before COVID and after COVID. Life after COVID will not be the same it was before COVID. There are just certain habits we're going to have to let go. Not because we think that these habits are harmful, but because we know that handshakes have been proven to be the #1 way of sharing germs, even before COVID-19. That's the truth. And we just have to learn these new normal ways. But in terms of your family, I actually think COVID-19 is a positive, because for many stay-at-home dads now, it's the first time your children are seeing you early in the morning. It's the first time your child can come and jump on you in the middle of the afternoon because there's no school. So that's a positive. But it's also important that you try, even at home during the lockdown, to keep a schedule. It's been found that if you keep a schedule before COVID-19 and during the lockdown you keep the same schedule, it reduces the tensions and the frictions. So husband and wife who never used to sit down for 12 hours or 14 hours a day, you still need to keep
a lot of time with each other. Yes. Dr. Banji, I love what you said about the namaste and the curtsying and greetings, because as opposed to going to a new normal, it's almost as though we're just going back to our old customs. But it is time for a quick break on The Morning Show. We will be joining you after the break. Stay with us. Welcome back to The Morning Show here on Arise News. We are still joined by psychiatrist Dr. Banji Adesoji. And prior to going on the break, we were talking about the new normal. Now, everyone seems to be touting this phrase about, but one wonders what this new normal is supposed to look like. We were talking about handshakes and the fact that we've all known from the beginning of time that this is a way to spread germs and diseases from one person to another. And the fact that we may just be going back to our customs and traditions of curtsying and kunleng to greet your elders and, the people that are around you, just like people in Asia do, where they bow to greet their people. So my question now to you is, what kind of support can we provide the most vulnerable of our community as able-bodied, well enough people, citizens? How can we assist those within our community who are not doing as well as we may be doing?
The first thing I would say is stay home, stay safe. Quite a number of times when I'm on the streets, on the roads, going out, I see quite a number of able-bodied young men playing football on the roads and all that. And that is a potential way of spreading this virus. We need to keep our social distance. It's just important. Secondly is we need to connect. I have a 75-year-old father, and I never used to call him every month. In fact, we used to do it once a quarter because we're men like that. I used to call my mom more often, but I had to be calling him every week because I know my mom is not around, so he can get lonely and he's vulnerable. He actually has pre-existing conditions himself. So connection is important. And then, of course, donating to as many things as people are able to do. I saw quite a number of people on Instagram donating food, even though with the backlash of they gave me more, they didn't give me meat. But we should give as much as we can. I can't count the number of patients of mine who call me and be like, send me something, I need to buy my medications, I need to buy food. I try and do as much as I can, but I'm just one person. But I do know this. Even if you cannot get money, if you do not have money to send, your time is way more precious. And people will value that. And so whatever you can, please contribute. It's very, very important.
And speaking of which, one wonders with 3.3% of health budget that goes to mental health. Let's even talk about at the policy level. There's really no mental health policy in Nigeria, from the federal government. And you wonder, with 150 psychologists or so to 200 million Nigerians, that is a far cry from, the present need at hand right now. Would you recommend some kind of deliberate policy, whether in terms of even attracting young people to take up, courses in the medical field, because there seems to be a dearth now in Nigeria?
And it'll be interesting to see whether or not Dr. Banji could give us his thoughts on whether he thinks that mental health and access to mental health care is a privilege, because if you look at the United Kingdom or the United States, for example, it's not something that's always covered by medical insurance. It seems like more of an elitist service.
But you are still able to access it for free when need be.
When need be. Yeah. But if we were to apply that to Nigeria, I wonder what the access is like. You just highlighted there's a huge disparity between professionals to the population. So,
exactly.
Dr. Banji, how do you think people can access mental health care in general, aside from COVID-19?
Okay, well, many questions. Let me start with the first. There's no mental health policy in Nigeria. That's the truth. There's been mental health bill that's been passing through the National Assembly since I got into mental health, and they still have another one. They've done a public hearing recently. I hope they eventually pass the mental health bill, because that will definitely solve a lot of problems. Lagos State has a mental health bill. It's been signed. Implementation is still in the works, but we hope it eventually comes. The issue we're having with mental health is the fact that we don't have enough, and the few we have, we are exporting. And that's the truth. There are more psychiatrists of Nigerian origin in the UK and the US than there are in the whole of Nigeria. And that's the truth. I have colleagues of mine who we finished medical school together who left after medical school. Then I had another set who left after residency. And then recently, in the last 2 years, almost like half have left. So the truth is, we're training a few number, but we are losing so many out of Nigeria. So if in terms of policy, the mental health bill definitely talks about training, definitely talks about encouraging more people to come into the space, but more importantly is the incentives to keep people here. Many people think it's money that makes people run and go to Canada, but the truth is it's not about money, because there's so much that $3,000 or $5,000 per month can do. The truth is the quality of life. The truth is the future of your children. The truth is what happens when an emergency. I mean, there's a saying which is true: Nigeria can kill you. Because no matter how rich you are, if you suddenly have a myocardial infarction at home, there's no defibrillator in your estate. And the ambulance may not get there early enough. And so you will die. And you might be a billionaire. So in terms of policy, we need to change a lot in terms of training, raising people, and then keeping them. And then it will shock you to know that there are more psychologists in the banks and other industries than there are in psychology. Because the truth is, the impression they get is it's not a very important thing. Which comes to the question of access. Yes, truth be told, mental health is a very uber luxurious thing in Nigeria. Because one, there are very few people, and two, is very few people are willing to come because there's a stigma attached to mental health issues. So Lagos State has a beautiful program called MEPRIC, which is bringing mental health to the primary care centers. So for instance, there are primary health centers in Lagos State that offer mental health services to people. Truth is, most people don't know, and then when you even tell them, they say, God forbid, it will never happen to my enemy. So that is some of the issues we're having, but with education and then with helping people to understand that mental health is not a death sentence. We used to carry the most stigma. I mean, HIV used to carry the stigma of you will die, now you can treat it, but mental health still carries the stigma of if you have mental health, Somebody will not marry a member from your family. I mean, I've had relatives of people tell me, doctor, please don't write her real name on the file because they might come and investigate and this might stop us from getting married. That's the country we live in.
Dr. Banji Adesoji, psychiatrist, it's been very, very eye-opening and very enlightening, your insights this morning on the show. And I would like to take that one home, Farabale. Relax.
Exactly.
That's what it means.
Take it easy.
Thank you so much. We all need to. Thank you so much.